All right. Let's talk again about what you need to know for the INBDE exam. Hello, everyone. Welcome again to another episode of the MDI Prep INBDE podcast, where we share actual topics that have appeared on the exam. As always, remember, these brief podcasts are just to introduce you to what appears on the exam, and they're not intended to replace an actual study program. Now, if you want to be involved in one of our classes, simply go to our website, www.mdiprep.online, or you can give us a call at 1-888-827-9881. And remember, all of our classes come complete with all the resources, and you have a final exam to make sure that you're ready to actually take the actual exam. Well, we don't want to waste any time. Today, back in studio, we have Dr. Marion, who's going to be sharing with us some very valuable information about herpes. And herpes is something that does come up on the INBDE exam. So be prepared to listen closely to these nice little tidbits about what she's saying about herpes. So we want to welcome Dr. Marion back to the INBDE podcast with MDI Prep. Welcome.
Hi, Dr. Sahin. Thank you for having me. Good.
All right. We are excited. So we don't want to waste any time. Let's go ahead and let you jump right into it. Tell us a little bit about what you remember from the INBDE exam regarding herpes.
Yeah, so I do recall that a couple of questions came up on primary herpetic gingival stomatitis, which is a condition that usually comes to kids and babies. And it's a self-limiting and located around, usually it comes around the oral cavity. And the question that comes with it is, it will be like patient box. So it will tell you a case, and they will give you a picture of a baby or a young kid, and you will be asked what is the condition and how you treat it. And they usually trick you with the treatment, because they will give you options like antibiotic, antiviral. And primary herpetic gingival stomatitis, it's a self-limiting. So you usually don't give any medication other than rest and hydration and numbing, anesthesia before eating to make it bearable for the kid.
And you know what? One of the things that I know a lot of people get confused about is that they wonder, is this a type of STD, sexually transmitted disease? And of course it's not.
Yeah.
Even though it is caused by herpes simplex type 1, which can lead to genital herpes.
Yeah.
But itself is not an STD. So I wanted to make sure people know that it's not an STD.
Yeah.
But that's good. So what type of answer choices do they have? Like when they ask this question, what are some of the answer choices that they might see?
They will ask what's your diagnosis of the case, and they will give you options like it's recurrent herpes, or it's herpes labialis, or other stuff that has herpes in it, but it's not the case, which is tricky.
Now is the photo pretty evident when you see the photo?
Yeah.
Okay, yeah, so it's no doubt about what it is.
It's very straightforward if you know that this is the condition, and usually it will be like young person with fever and oral vesicles. Once you know fever and oral vesicles, it's usually primary herpetic gingival stomatitis.
Good, and it's pretty self-limiting, so it pretty go in about a 1 to 2 week it goes away. Anyway.
Yeah, it is self-limiting, and usually it happens between 6 months to 5 years, and the prevalence usually between 2 to 3 years of age, and usually before 6 months it's very rare that you will find the virus, the herpes, because of the maternal antibodies. So it's not the case with kids or babies before 6 months.
Now, let me ask you this. So when you see that patient box and they give you the patient box with the picture, is that the only question that will go with that patient box, or do they have that particular patient box and picture and they have other questions that go with it?
Yeah, usually if you have a patient box, it will be a series of questions. So the first question will be, what's your diagnosis?
Okay.
Second question will be how you treated. Third question will be something also related to the case.
Gotcha. So there'll be a couple questions related to that particular diagnosis.
Yeah, and that's the new system which we're not familiar with.
Ah, very good, very good, very good. Gotcha. Very nice. So is there anything else related to the herpes piece? Because I know herpes is pretty popular on the INBDE exam.
Yeah, it is. And the other one actually that I did see it on my exam is the recurrent herpes. And it will be a patient box and will be like patient with 1 to 2 millimeter vesicles, and it's on a keratinized tissue. And the patient says that her mouth is sore and painful.
Okay.
What do you give this patient to treat her chief complaint? And usually one of the options will be like lidocaine mouth rinse to relieve the pain.
Okay.
And the other options will be like other like stuff that doesn't make sense.
Okay.
Yeah.
Okay. So let me just make sure I understand that.
Yeah.
So this would be a case where it's recurrent herpes.
Yeah.
And they'd ask for a treatment option.
Yeah.
And so with the treatment options, do they give you like an antiviral as a treatment option?
No, not this case. No, because antiviral will be a good option actually.
Okay,
Yeah.
but they don't give you that as an option.
Yeah, no.
But the answer choice would be lidocaine. Would you say lidocaine with what?
Lidocaine mouth rinse.
Okay, gotcha.
So and
that's for the pain.
Yeah, that's for the pain.
Gotcha. Very good, good. And so the other choices would be so far left that you wouldn't even think that's an option.
Exactly. But the other option, the other question that will come up with the antiviral will be another question on the patient box will be like upon finding out the condition, what medication do you give to the patient? So medication will be something different.
Yeah. See. That's when you would probably use like an acyclovir or something like that.
And that acyclovir will be one of the options.
Because that's pretty common, right? Yeah. That makes sense. So anything that ends in VIR, those are, I guess we remember from class, from our INBDE class, those are your antivirals.
Yeah.
Okay, very nice. Okay. So is there anything else related to the herpes that you want to talk about that may have appeared on the exam? I mean, we know there are other types of herpes, like herpes type 8. Which is the Kaposi sarcoma.
Yeah.
Right. Now, is that something you've seen before?
I did, yeah.
Okay.
And I guess I saw one question about it.
The sarcoma, right. Because that's the one that typically gives you that dark, patchy look.
In the mouth,
the mouth, yes. And most of anytime you see like the Kaposi sarcoma, you're thinking more of HIV, immunocompromised individuals.
Yeah.
Okay, good.
Yeah.
Well, I tell you what, those are some very good tidbits we need to know for herpes. So those are good things that we need to know. So once again, like I said, we appreciate you taking the time to come out, talk to us, share with us. And we know that this information is going to be valuable for the next person that's taking their test. So until next time, I'm sure we're going to see you again very, very soon. But thank you for coming out.
Thank you. Thank you for so much for having me.
And remember, again, if you ever want to take any of our INBDE classes, our classes are lasting about 3 to 4 months. They are complete comprehensive classes. They're live, online, interactive, and it comes with a 90% guaranteed pass. Simply reach out to us at www.mdiprep.online. Until next time, remember, no matter how tough it gets, you got this.